Okay, we have 2 minutes. All right, Jendelle, it's 2 o'clock and we're ready.
All right. Welcome to today's town hall. Whether you're tuning in via Zoom or Facebook, we welcome you. I'm one of your moderators, Jandelle Crutchfield. I'm currently an assistant professor of social work here at the UTA School of Social Work. So today is the culmination of a 3-part series on COVID-19, diversity, and health disparities. And at our first panel on June 25th, there were just over 9 million confirmed cases of COVID-19 and nearly 500,000 deaths across the globe. And the US numbers on the 25th were 2.3 million confirmed cases and 121,000 deaths. In just 3 weeks since, those numbers have increased globally by 4 million cases and 100,000 deaths. In the US alone, the numbers have increased by 1.2 million confirmed cases and nearly 20 more thousand deaths. So this pandemic is ongoing. It continues to be alarming, and it will continue to be a challenge that we will be having to face. Also, since that first panel, there have been 45 straight days of protests against racial injustice in the United States and across the world. The US is seeing policy changes from major companies, sports leagues, and state governments. NASCAR has banned the display of the Confederate flag at its sporting events, even as the Mississippi State Legislature has voted to retire their state flag that displays the Confederate symbol. Entertainers and sports teams are changing racist names and images. Black Lives Matter is being chanted in protests and painted on streets. While some of these changes are symbolic, they characterize the strength of the larger movement for racial justice happening now, and it will continue. So in this town hall today, we want to hear from you about ways to keep shining the light on the intersections of race and COVID-19. And so by offering you a short commentary today on these topics and posing questions to you as the audience, we hope to gain an understanding of what you believe are sustainable solutions to our current challenges. And so before I introduce our two moderators for the town hall, our host, Coral Simpkins with the UTA School of Social Work Office of Communications, will explain the logistics of how the town hall will work today. So Coral.
Well, first, I'd like to start out by saying welcome to all of our participants today. We are offering CEUs, so participants who want to earn CEUs, you must watch the live Zoom presentation to receive CEU credit. This is the only way that we can document your attendance for the presentation. So if you would like to earn CEU credits and you're watching via Facebook, we will post the link to the Zoom presentation in the comments, and just jump on over and join us on the Zoom webinar. At the end of the presentation, we will put up our email address for the School of Social Work Special Events. You will need to email the Special Events Department in order to request your certificate. Once we receive that email, we will make sure that we get that information issued out to you. Also, for a Q&A or for questions in your responses in interaction with our moderators today, for Zoom attendees, you have the option to use the Q&A feature, or you can raise your hand if you would like to speak directly to the moderators today during our town hall. For Facebook, because you do not have the option to speak with us, you will just need to post your comments or share your thoughts and ideas in the comments, and we will read those off and share those via our live Zoom presentation. All right, and I will hand it back over to Jandel.
All right, thanks so much, Coral. So now I have the pleasure of introducing our other two moderators for the town hall today. And so first is Dr. Allison Tomlinson. She's an assistant professor here at the University of Texas School of Social Work. Dr. Tomlinson is a licensed clinical social worker and a state of Texas board-approved supervisor with over 13 years of experience in social work practice. Her practice and instruction draw on diverse career experiences in multiple areas of social work, including policy work through criminal justice reform with the Washington, D.C. Juvenile Detention Alternatives Initiatives and the Office of Justice Programs, as well as medical social work as a former hospice administrator and as a practicing clinician, providing clinical therapy to children and families in the child welfare system. So we're happy to have you, Dr. Tomlinson. And we're also happy to have Mr. Antoine Williams, who currently serves as an adjunct assistant professor and the manager of communications, community outreach, admissions, and recruiting for the UTA School of Social Work. His and his team's work for the School of Social Work has been invaluable. As an adjunct instructor, he teaches the social work undergraduate course, Social Welfare Policy and Services. Mr. Williams is a retired U.S. Army Lieutenant Colonel with nearly 30 years of experience leading public affairs, public relations, communication, marketing, and human resources organizations. Among many other prestigious positions, he served at the U.S. Military Academy at West Point as the Director of Marketing and Public Relations for Admissions, and later as the West Point Academy Deputy Director for Public Affairs and Communication. So I want to thank you both for your time today. And so in the town hall, I'll spend some time recapping the previous panels. Dr. Tomlinson will provide some extra commentary throughout and respond to comments from the audience. And Mr. Williams will also similarly respond to your comments. And so we hope that you guys remain engaged in what we hope is going to be a great discussion. And so now I'll recap the first panel. The first panel, and hopefully some of you guys were able to attend that, featured several UTA School of Social Work professors discussing how racism affects health outcomes. Namely, when we consider where a person lives, works, and their access to quality healthcare, it's clear how systemic racism negatively impacts people of color. And so that same level of systemic racism creates inequities in education, housing, healthcare, economic stability, criminal justice, and just about any other sector of society. A long and well-documented history of systematic discrimination against people of color regularly leads to worse underlying health conditions that make it more likely that they become severely ill during this pandemic and die from COVID-19. And so the first panel addressed both the current trends in COVID-19 in health, mental health, domestic violence, aging, and child welfare, as well as the focus on the intersections of racism and COVID-19. And so in panel one, we sought to equip students and community members with data and information to support action and advocacy. And so Dr. Tomlinson will provide a little bit more perspective from that focus from panel one.
Sure. So as we discussed and conceptualized for today's town hall, we talked about that we've shared a lot of information with you if you've participated across the 3 town hall sections. So the first panel really addressed the specifics of how we see issues related to racial disparity interact across the different service provision areas within our discipline and practice of social work. And so those are numerous. They would be a really lengthy list to recap, and we basically have to take the entire town hall for this section to cover the nuance of each of those interactions. But what we found overall, and what today's panel really wants to focus on, is kind of merging the two panels, the two experiences in the town hall so far, and talking about how we move forward in actionable ways to address the disparities that have already been elucidated and expounded upon and really delved into more deeply in the first panel. And what we see is that across the different areas of social work, when we talk about how does race influence the impact of COVID-19 and its health disparities, is we're talking about, as clinicians, really needing to make space to recognize the cultural experiences of clients of color. And so seeing that there is a complexity to the experience of race and how it interacts with someone's health, but what we know in terms of holistic impacts of working with people and the dynamics of people and intervening in social work is that there is an element of culture that can serve as a factor to resilience in working with communities of color. And that is what the social justice movement that's taking shape right now, as well as the COVID-19 response really has to focus on, which is the idea of how do we take the cultural resilience that people exhibit on a daily basis to navigate systems and to navigate their experiences as an African-American or a person of color across experiences. How do they bring that into each of these dynamics? So we discussed in the first panel how you see that take shape in academic sectors with schools. So when we talk about COVID-19 and the impact in the education system, there are disparities, there are differences in terms of the impact for communities. Some folks will experience being under-resourced, and they will experience not being able to make the transition to this virtual world that we're all living in as a result of COVID-19. So when we talk about drawing on cultural resilience, we see a lot of the networks that have been created informally, where people are drawing on neighbors and friends and sharing of resources and able to, in order to be able to keep their family moving forward and to keep their social environment moving forward and supportive to their children. And that's just one example. It's happening across systems. It's happening as it relates to healthcare in general and supporting people and the encouragement to get them to the correct healthcare resources. But really, when we talk about how we draw on that first panel, what we really wanted to highlight is how do we help people navigate healthcare systems well from a cultural perspective. And so I know that Dr. Crutchfield is going to pose the question about how maybe some of you will be doing that, but some of the things that I just wanted to highlight is really fostering fortitude to not make assumptions about what resilience looks like for people of color, but to draw on their actual experiences and to make space in terms of our interactions, regardless of the setting that we find ourselves working in, for exploring what resilience looks like for the person of color that you're working with and for their community context. Because we want to create an interconnectedness. That's really what is being highlighted in the social justice movement about what doesn't exist in our society, is that the experience of folks of color is not on the main stage always. It's not frequently elucidated. It's not frequently tapped into when it comes to our helping intervention. And so we have to draw on their experience of psychological fortitude or interpersonal fortitude that's brought them to this moment when we talk about really intervening and having a conscious awareness of how there are disparities across systems that impact people, especially during a time like the pandemic. And then recognizing the threats that exist to psychological, social, emotional, and health well-being right now in communities of color. And that's language that we're not always talking in, but because of the current status of the social justice movement and because of the current pandemic, we really do have to talk about that there are threats to access of service that exist for communities of color across all service areas that interact with social work. And so we have to be addressing the threats in order to address and reduce the disparity. And so we really, I don't think this is a one-sided conversation. I'm not able to tell you every way that you can address the threat. We want to, as a community, draw on ways that we're hearing folks addressing these threats, reducing these barriers to really acknowledge that experience for people of color and to really foster the fortitude and enhance their sense of security accessing the services and really being able to traverse and navigate this time. I'll turn it back over to Dr. Crutchfield. Uh-oh, you're still muted.
Thank you. So now's a chance for us to hear from the audience. Hopefully you guys can see this question. It says, how do you integrate advocacy for social justice with a focus on health? And so again, Dr. Tomlinson has done a good job of some of the considerations and solutions potentially for figuring this out, particularly we're a school of social work with a focus on social justice. But how do you guys think it's best to integrate advocacy for social justice with a focus on health? And so Coral, could you give a quick reminder about Zoom, how they can participate if they would like to?
Yes, so for Zoom, if you would like to participate, you can raise your hand, which you should see at the bottom of your screen on your menu. Or you can, if you don't want to speak, you can type your questions, thoughts, or ideas in the Q&A section. If you are on Facebook, you can type those questions, thoughts, or ideas in the comment section. We are monitoring those and we'll read them off here live on the Zoom.
Okay. So the question on or up for discussion now is integrating social justice with the focus on health. And so I'm sure not everyone on is a clinician, is a social worker. And so that could mean in your own areas of community that you live in, with your families, in healthcare settings. So we'd love to hear from you guys. All right, so it looks like we have a comment, and that this is coming in from Facebook from Melanie Johnson. Hi, Melanie. And so Melanie says that she's created facilitation for nursing schools to talk about biases and stereotypes through healthcare and how harmful it is. And so Mr. Williams, Dr. Tomlinson, what do you think about facilitation for nursing schools, right? We didn't think about nurses, or I've talked about nurses much, and how that might be one of the solutions there.
I think that is a wonderful move in the direction. I think that that's really important. We have to take, we talk about COVID-19, especially in the pandemic, and how it's impacting communities of color, taking what is known into those sectors and really working across disciplines is going to be really vital for all disciplines really that are responding to how this pandemic is affecting people. So I think that that's a wonderful step that was voiced by Melanie. And I think it is something that we have to see more of. When we talk about healthcare systems and understanding the unique ways they present concerns for people of color, we really have to specifically focus on that there are a lot of intersections for people. And I know we'll get into that more in the panel, but really just looking at, so a person who has a pre-existing condition that puts them at greater risk may also be experiencing some emotional and psychological well-being issues that interact with the original illness. And how is that going to be exacerbated by concern that you might have COVID-19? Will it impact your willingness to go out and seek services? Is it going to increase your anxiety once you actually enter into that healthcare system? And then can people really respond to you in ways that will inherently foster your willingness to adhere to the healthcare advice and to what is told to you as a result of your interaction? I think that becomes important for folks who work in that environment to really know the best ways to intervene and to help families in that situation.
I believe that's absolutely correct, Dr. Tomlinson. One of the things, and we talk about health disparities and the concerns of health disparities on race and marginalized populations that are left out. Part of what with adding in and having the healthcare teams of nursing and nursing assistants, you have social workers, all part of the healthcare team, healthcare practice team. In the educational framework, in the academic setting, ensuring that even in those classes and those courses that anti-racism and health disparity and those and social justice issues are incorporated throughout the curriculum. So they're getting that not only in their educational environment and hopefully in their field practice, so they continue that. Oftentimes it's this constant training that we have to do that's being done in the field after they're in the profession, after they're actually working in the hospital setting, in the clinical setting, and trying to get this, have that training early on. And then it's infused throughout their learning time. And it's part of the, like CEU's continuing credit that you earn every year. Maybe that should be part of that. Maybe it should even be required. And that's something to look at for licensing and policies to stay active in your licensing too, that you get that type of training and understanding and the latest issues that are dealing with disadvantaged and marginalized populations. Because we do see that, we see that with the COVID-19, the health disparities, but this has been an issue prior to, it's just now it's more exacerbated. We can see it in this larger pandemic, but it's been there already throughout the healthcare process and system, and even in social work and social welfare programs as well.
Great. I love the idea of CEUs, right, and having ongoing discussions. So thank you for that, Melanie. She also added that there should be a push for diversity in healthcare professionals on college campuses because of those biases and the reluctancy of some people of color to attend health avenues like counseling or regular checkups. What do you guys think about that in terms of people of color maybe not necessarily wanting to go to the doctor because of the experiences that they have with racism or, you know, therapy or counseling? Is that something you guys see, experience, or think should get better?
Yeah, I know from the research that I've seen, that has been the case. Lots of research has shown that you have, especially communities of color, you have marginalized communities, African Americans, Latinx, they're not wanting to go to see healthcare providers, or because of those previous experiences. There's quite a bit of research out there that shows, you know, the lack of concern for when a person of color says they're in pain and not receiving the same level of pain medication or being taken seriously. And so when you have those negative experiences, you're less likely to go back. And then on top of not having access to healthcare, or the lack of a quality healthcare in many communities also leads to that as well. It's not part of the culture of seeing a doctor once, twice a year. That's not even part of the culture because of growing up in an environment where you didn't even have that access in the first place. So, yeah.
I would agree. And I would say that as schools of social work like ours and across disciplines, that what we also need is an increase in educational awareness about where a lot of that historical anxiety about engaging healthcare systems comes from. You have certain communities where it's very understood that there's a lot of sanctioned systemic injustice related to experimentation when it comes to health within communities of color. African American communities especially, but across different communities of color in our country specifically. And so we have to be aware of this as professionals across disciplines that relate to health, social work as one of those allied disciplines with traditional medicine in terms of hospital settings with doctors and nurses, et cetera. But on even a everyday, your primary healthcare provider level, there's a culturally engendered kind of angst about will you receive equitable treatment for the reasons that Antoine just named, that, you know, there's a concern, will my pain be taken seriously? Will my report of my symptoms be taken with serious consideration? But then there's also the factor that we have very standardized norms about, especially when it comes to mental health, what mental health presentation looks like. And some of those don't include the cultural experiences of communities of color. An example of that would be that depression does not always look the same in African-American populations. And a lot of that is because the culturally engendered stress of racism makes us normalize a lot of things that could be on the scale of psychological issues. That we normalize anxiety because we experience racial anxiety. We normalize depression because we experience cultural racial sadness. And so when we're asked about our symptoms, clinicians may sometimes ignore symptoms that don't meet their clinical threshold, but are actually problematic and symptomatic of greater distress. And so we have to be mindful of that as a healthcare community, because we also have to be mindful of how various health issues intersect. So if I have a chronic pain condition, I also have racially engendered, sadness and angst. And then I also present clinically for depression. I'm going to need a different level of holistic treatment. And I'm going to need people to be okay getting into that experience and exploring more in-depthly how maybe the factors that impact me racially are different for me and my experience of my chronic pain and my depression than for someone else in another ethnic group. And so that just becomes really important for us as clinicians to broaden our awareness and the scope of what we consume so that we can be better at providing services. So it is one of those really making sure that resources are available to help educate clinicians, but also making sure that we as helping professionals, regardless of our occupation, that we're also doing the self-education to really learn about not just what disorders and diseases and illnesses look like in my specific window, but what do they look like in some communities that maybe I'm less informed about.
All right, so Melanie Johnson is giving some snaps. All right, and so speaking of Diane, speaking of interpersonal or interprofessional education, Diane Mitchke from Facebook, hey Diane, is saying that much of the work that we're doing at UTA and in North Texas focuses on interdisciplinary education, bringing nurses, physicians, social workers, and other allied health professionals together to conduct holistic assessments that address anti-racism and uncover racial and other biases. And so I think that, kind of resonates a lot with what both of you guys are saying in terms of continuing that education, bringing people together, and considering the larger kind of movement of bringing people together. It's a great time to focus on interdisciplinary, some people call it interprofessional education. So do you guys have any other thoughts on this? We didn't hear from anybody on the mic. I want you guys to unmute your mics and talk back to us. So if you're shy on that first question, we have a couple more questions coming up. But any final questions? Any final comments, Mr. Williams or Dr. Tomlinson? No? Nah. Y'all good? All right, cool. I will stop this share and I will move on to recapping the second panel that we had. So let me pull up notes here. All right, so panel 2 highlighted perspectives from practitioners of color about their experiences and addressing changes to their practice due to COVID-19. So panelists included social workers serving victims of domestic violence, hospital patients, serving students, children and families, others with mental health needs. And so it was a really wide perspective, and each panelist offered descriptions of how they had to use creativity, they had tenacity in figuring out the necessary changes as basically COVID has flipped upside down the way that they deliver services, the amounts of service they're able to deliver, the kinds of services available, and even navigating safety and health precautions while delivering those services. And so I think one of the major takeaways from the second panel was just, I think it demonstrated the great capacity for social workers and health professionals to meet the challenges presented by COVID-19. And so it was really, a strengths-based presentation. And so that's the recap of panel 2. And I think Dr. Tomlinson, you have some more thoughts potentially on that area of practitioner wellness and client wellness.
Yes. So as Dr. Crutchfield shared, that the second panel really focused on practitioner and client wellness. And I think a lot of specifics were shared about how practitioners across different environments were really retooling the way they thought about some problems to address issues posed by the pandemic, but those also posed by some cultural factors. And one of the pieces that kind of came up that I noticed or kind of highlighted was this idea of that how we as intervening, folks intervening to help others can really advocate and can really create a reshaping of these spaces and re-envisioning of spaces. So we talked a lot about stress in that one. We heard a lot from panelists about the different levels of stress that are caused by working in these unusual circumstances. And so what we know is that stress can harm you not only physically, but it can harm you mentally. And so I think that really paying a lot of attention to the interplay is really important. And especially as we're wrapping up this town hall series and wanting to draw attention to the intersections, really noticing that we need to help folks not neglect either side of their well-being, the physical or the emotional. There's a lot of tendency to minimize, especially when we talk about communities of color. And so we really have to help people deal with the way they minimize the health risk and concern, but also the way they minimize the experiences that they have related to race, that people tend to either try to assimilate or internalize their experiences of racism. And we really have to help people understand that it's not necessarily a normative experience, and that the world that we sit in and the experiences that we're watching unfold don't really fit into a normalizing category. And so if we're talking about well-being and promoting your well-being, we have to help people come to terms with that and acknowledge that and really unpack what that means for them related to either side of their health and well-being. A lot of folks have a tendency that they minimize the health concerns and the health risks, even though they might know they're in a group that has higher risk levels or risk factors, but then at the same time, they're normalizing the angst and whatever other emotions come with that. And so we have to help people really be more explicit about understanding this isn't something we can normalize and rationalize, and this is something we have to give its due attention if we're going to do our best to really promote wellness. So I'll turn it back over to you.
Okay, all right, great. So here's another question for you, audience. Let's see if I can get my screen shared here. So there are 2 questions for this particular section. And so hopefully you guys are able to participate in this, because hopefully you are seeing some stuff happening. The question is, what are you seeing your agencies, your communities do to address COVID-19? And so that could be you as a practitioner, you as a student who is in a field placement and in a precarious situation. Communities right now, the big hot topic question is, how are we going back to school, if we're going back to school? So in what ways are agencies and communities doing their best, or have you seen some great ideas out there where people are addressing COVID-19? So let me see. I think we have something in the chat. And so I have from Deborah Dunman. Thanks for responding, Deborah. It says, we have made our classes and support groups at CARS available to clients over Zoom, right? And so that's a good thing, because a lot of times we are participating in work type meetings and settings, but to provide it to your clients in those actual support groups. Deborah, it looks like you're on Zoom. I'm not sure if you want to unmute or tell us more about that. That sounds interesting. I'm pretty sure other people have had that experience. Dr. Thomason, I know you're providing counseling. Mr. Williams, if you guys are hearing more things like that, like actually offering services, like I guess it sounds like telehealth. Is that what it is?
Yeah, can you hear me okay?
Yeah, I can. Hey, thanks for sharing.
Okay, hi. Yeah, so ours is the Center for Addiction and Recovery Studies, and it was on the campus of UTSW, but now we're virtual. And I'm one of the practicum students there. And what we do, we offer parenting classes, usually for clients that are referred by CPS. So we do parenting, drug education, and then also support groups for moms that are in recovery. And we've been able to offer all of that through Zoom, but it's really exciting because actually a lot of the barriers that clients usually have, like transportation or childcare, those barriers are actually removed now. So we're seeing a lot more people graduate from classes. So that's been really neat to see.
Absolutely. You guys want to follow up, Mr. Williams or Dr. Thomason? That sounds very exciting.
Yeah.
I think it has been a turning point in terms of distance sometimes about access. So I think that it's very exciting that you guys were able to make that pivot and transition to kind of create this avenue for services to go on. I know that even in my work in private practice, that for some of my clients, it has been a success point that they have been able to, it eliminates some of the barriers that have created challenges to engaging them in therapy. So they don't have to drive as far. They don't have to take time out of their schedule in the same way and all of those things. But for other populations, it can be a challenge. And I've had to reckon with that. I think we have a comment in the chat that actually kind of points to that, thinking about communities where access is still an issue because of disabilities or any other circumstance. And that is something I've had to think through. From some of my families and children that I work with, that is a barrier. And so we've had to actualize, like, what does this look like for you? Sometimes that means empowering somebody in the family system to really enact a part of the services. So I'm coaching them so they can perform part of what I need them to do physically in the space. So it does mean I have to tap into the system a lot more. And I think that social work is a unique place to teach other systems. And for us as professionals, we are versed in those skills of how do we empower an entire system to galvanize to support someone where maybe some of the functions that you usually have to physically go access, they can be accessed, but through coaching someone else. So all of those things I think are very important.
Good.
Absolutely. I saw that too. I think across the board, we're seeing with technology, people are beginning to are helping think outside the box and how in different ways they can approach working with clients and patients and helping them through the process, whether it's in social work or in healthcare arena. I'm even seeing it in communities with agencies and with churches. Even a story with my mother with her church. Her pastor was very reluctant early on in March and April to go on Zoom or go on Facebook Live. Did a lot of training, and then now you can't get them off of it. and they see that they can now reach people in a different way. And you can find that in any profession, because like you were mentioning with disabilities, and a person not able to maybe get in to see their practitioner or is difficult already. And now clinics and agencies are saying, hey, we could have been doing this all along with telehealth and doing virtual and helping. It's not 100%, but it does help with particularly communities that are marginalized, not able to get in and see providers. So we're seeing that across the spectrum, from religious settings to healthcare settings, in the schools. If you have school-age children, I know this past spring, we all went through some challenges becoming full-time teachers at the kindergarten and middle school level, or high school in some cases as well. But that technology is helping and just thinking outside the box and reinventing it a little bit.
Gotcha. I wanted to acknowledge a comment, I think, from the last question about interprofessional education. So Tracy Orwig, hi Tracy, from Facebook said, yeah, IPE, right? So she has a lot of experience with interprofessional education. But Deborah, Dunham had a follow-up comment and is sharing again, if we have clients with unstable housing or without reliable cell or internet usage, that can still be a barrier to services. So still considering some of those. And then Darlene Hunter, hi Darlene, is saying here on Zoom, I think it's really important that as we're moving services online, we need to think about ways to make it accessible for those with disabilities. It's amazing that we can move everything online, but we can't forget this community. And so I think both you, Dr. Thomason, and Mr. Williams were talking about still thinking about those who are marginalized, particularly those with disabilities. And so that's a big question. And I wonder, you know, if anybody else has seen, as we're sharing, thanks for everybody that shared so far, some stuff that's working. I don't see any more comments from Facebook at the moment. Let's check the chat here. Got it. All right. Okay. So let me go on to the next question from this same, oh, I think I just got a notification. All right. So Rachel Vatshrag, hi, Rachel, is saying, how do we galvanize systems to address access? Yes. Thank you, Dr. Tomlinson. Okay. So that was a question you said. And so she's just saying, yes, she's like snapping it up too. And then, so there's another comment in the chat here from Sherry Willis. Hi, Miss Sherry. Hallmark Baptist Church in Fort Worth has made it safe for its members to attend church in person. They have a 9:15 a.m. service and a 10:30 a.m. service. The pews are marked 9:15 a.m. The next set of pews are marked 10:30 a.m. That's smart, from the back to the front. They professionally clean between each worship service. There are people holding the doors open, so no touching. There's plenty of room for social distancing. The church is essential if done right. I like that phrase, Miss Sherry. The church is essential if done right. And so, you know, like Antoine shared about, you know, his mom's church with the pastors learning about Zoom, people can do it. And so it's always encouraging when we hear stories about people in communities and professions doing that very thing. All right, so I was putting up the last question for this particular session. So hopefully you guys can see this. Here it is. All right, so how are communities of color often left out of the practitioner dialogue about COVID-19 changes and needs? Because I think a lot of times there are actually just things physically that have to happen. And I'm going to use the school example, right? Right now, schools are posting plans about how we're coming back to school, what our physical facilities will look like, what virtual learning may look like, and not necessarily looking at the most vulnerable populations of students that they have, or even considering them in those plans. And so as social workers, as practitioners, as community members, how is it that you're seeing sometimes communities of color, or we've mentioned those living with disabilities, other marginalized communities are kind of left out of that dialogue and that conversation? Where are you guys seeing some of those gaps? So we'll let you respond to those, or any other questions. If you thought of something, that's how it happens, right? You're like, oh, I wanted to say something for that first question. This is the town hall where you can do that, right? I always do that. I'm like, I'm on question 1 when everybody else is on question 3. So we'd love to hear kind of what you're seeing, where there may be some of those gaps in terms of how people are responding to COVID-19. So we'll wait for some chats. Let me check the Facebook screen. All right. Go back here. Any takers for this question? I'll leave it here a few more seconds.
And I know there had some research. I recently read some papers put out concerning that having access to data, having access for practitioners to have access to data, and even researchers to be able to then share and then establish evidence-based practices or best practices in different fields. And so I think oftentimes communities of color are left out because the data that's even being collected for those to research and publish and share best practices, you don't have the data to even collect. And we're seeing some concerns now, even data being collected for COVID-19, if it's going to go to Health and Human Services, or is it going to go to continue to go to the Centers for Disease Control. So I know working with some of the other professors, and when they've done their research here in School of Social Work, that was part of what they're saying. Some of their concerns were with getting data, getting good data, up-to-date data, and then even the data that some agencies are not collecting, particularly at the federal level, agencies not collecting data, or the data is 4, 5, 6 years old, to even be able to look at and assess and come up with some proposals for best practices. And we see that often in communities, color, disadvantaged communities, marginalized populations, and even in rural areas and rural settings too.
Mm-hmm. Yeah, so like literally not just out of the discussion, but out of the literal numbers, out of being counted. That definitely would be detrimental, right? To being able to then get resources allocated back to you if you're part of that community. I don't know if you had something else, Dr. Thompson, before I read some more.
Oh, sure. It actually goes into a couple of things you see in the chat. I'm glad that somebody else brought it up because it was kind of two of my points. But the first one is that when you talk about folks who are left out and looking at communities of color, you have Deborah Dunman said the single parent family communities of color, which I do think is a very important issue. I think that's across the board for any race of people, the single parent families and the impact that any returns to school or changes professionally as a result of kind of some of the guidelines that are coming out, those impact families where you're a single parent very hard. But the other piece is, even in dual income families, when you look at families of color across economic demographics, we work. So if you have to work and you have a higher percentage of two working parents in families of color. And so knowing that, that's going to be a challenge for any family, but knowing that you have two working adults whose schedules may not be manipulated to accommodate the changes that are happening in the education sphere, that's really difficult because then those parents take those anxieties into work and it just reverberates across systems. But I also like the comment that Melanie Johnson wrote, which is that you have a large portion of blue collar working class parents of color, or people of color rather, who are left out of the conversation about what's expected. And so we have to be aware of the nuance of how, for communities of color, these issues look. That to Mr. Williams' point, the idea that you're not seeing people of color represented in some of the statistics and demographics. The other piece is largely blue collar, working class, middle class communities of color are largely often left out of research because we're not as easy to access. That it's a little bit easier to access low income African-American communities, especially, and Latinx communities, because they're engaging services where people expect to find that population. But then often we see in research that folks aren't going the extra mile to get a representative picture across demographics of communities of color. And that's highly important to how you intervene with communities of colors, to know what intervention needs to look like from high income to low income and everything in between. And so I think that's an important piece that we have to address in the dynamics of how we respond to COVID-19.
Good. And Dr. Thompson read a little bit of your comment. Melanie, I'll just read the thing in full. So a large portion of the blue collar working class is people of color, often left out of the conversation how they're expected to work while daycares are shut down and or schools. Many jobs are not flexible on bringing your child to work. It's not possible either. So we see those numbers high in those communities. And as the phases come out with the plans, they're taken from an ivory tower look and not a person of color working class view. And that has been a criticism, that even I've heard of a lot of the plans that are coming out in terms of schools and other things, reopening plans is definitely leaving that demographic out of the planning stages. I can't. Trying to access see if there's any Facebook comments here. Rachel Vostreg again says, anytime, like in domestic violence services, where we expect law enforcement to be a front door to services, we leave out communities of color with community-based services at reduced capacity. So with the reduced capacity of community-based services, this stuff is happening more. So Rachel's saying anytime, that's where we're expecting law enforcement to interact with people first, those services definitely leave out people of color. Absolutely. So let's see. So I had that question up. I don't see any more comments there. So let me get back to my notes and we will keep going. And we have a few more questions left. So you guys still have a chance to share some of your thoughts. Thank you so much for those who participated so far. And so just want to repeat for you guys that we recapped panels 1 and 2 and kind of given some commentary. And so today in this town hall, we really are trying to see ways that we can keep shining the light on these issues. We've just talked about how people have been left out of the discussion. And so how can then we keep shining that light? And so Dr. Thompson is going to share a little bit more about the intersections of COVID-19 and race and kind of a focus on where we go from here. And then we'll ask 2 more final questions.
So as we conceptualize this third kind of pulling together the ideas, we talked about that we've covered how can we respond to COVID-19 and its impact across communities of color, its impact with communities that are often disenfranchised. And then we talked about in the second panel, as we've recapped, about how do we help people be well? How do we keep ourselves well as practitioners? How do we keep ourselves well as individuals? And how do we help others keep themselves well? So clients. So we talked about that in panel 2. And so this last panel, as Dr. Crutchfield shared, is we're bringing it all together. We want to help people understand this intersection, this unique intersection that's happening in our country. The idea of that there's a racial social justice movement that it's happening and it's in full effect, and it's really, we're seeing the images in more real time due to all of us living in this virtual existence. So we're constantly consuming media, or we're, on virtual calls, or whatever the case may be, and we're consuming the media that is the result of a movement. And so there's a reality there. There's a reality about the experience for communities of color, specifically the African American community, being elucidated the world over. And then you at the same time have this convergence with a global pandemic. I personally feel like there's a uniqueness that the pandemic has created the room and the space for this movement to be on the world stage as it is, which is a unique thing. It's sad in how we came here, but it's wonderful in the sense of that there are finally eyes on the existence and the experience. But how do we then deal with the intersection is what we kind of came together to talk about. And so I really just have a few things from our last panel about emotional wellness that are highlighted for me. I think about that we can't neglect that emotional and physical health piece. And really what that looks like is that we have to acknowledge the struggle that communities of color are facing in responding to the pandemic and dealing with the images of racism and racial injustice every day. So while we're fighting social and systemic racial injustice, we're also internalizing that experience that communities of color have already coalesced around that we share. And that specifically in the African American community, there is some version of a group consciousness about this experience. So when I watch police brutality on the news, it's not a removed thing for me. There's a visceral experience that accompanies my watching and consuming the media. And so we have to acknowledge that that's happening for people in communities of color all over the world, but especially here in the United States, especially here in Texas, and those who are impacted by us and our work, for those of us participating in this town hall. And so we have to acknowledge that, and we have to help people deal with that emotional struggle. And sometimes that means helping them shed the worry about things that they can't change, and help them deal with and bring in and talk about and unearth the things that we can't change, so that we can deal with the realities of what we can change. So while we need to draw on our toolkit as clinicians, we also have to help people deal with the realities of the intersection. And then we have to be willing to address the racial anxiety that exists as a result of the issues of injustice that we're acknowledging at this point. There's police brutality that exists towards African Americans and that has resulted in death. And there is racial injustice, there's racial anxiety that is stoked as a result of that experience. And when we talk about systems, children are going to go back to school and have seen the videos of George Floyd being murdered. And there is a real visceral impact for children of color. So you have dealing with that emotional experience and dealing with the anxieties of living in a pandemic environment. And so we have to be willing to address the intersection for youth of color. That may look like more anxiety in the classroom, which sometimes for children manifests as what's perceived misbehavior. That may look like inattentiveness. So those are environmental circumstances we have to acknowledge. That may look like patients who seem less compliant, but their compliance may not be willful non-compliance. It may be I'm anxious and I still haven't really worked through my emotions related to all the things that I'm exposed to right now. And we have to be willing to acknowledge that for them and explore around it. And so we have to be willing to bring in the conversation about that racial anxiety. And then we have to be intentional about helping people manage their reactions. So that may mean they set limits on their media exposure. It may mean a direct dialogue, and we incorporate into whatever our treatment plan or intervention plan or whatever, we incorporate how we're going to address that. But we have to be intentional about how we're going to help folks respond to those triggers or those anxieties and how they present in the setting that we work. So that's kind of my little synopsis. I really want to hear more from other people about how they think we can do that well.
Yeah, okay, good. So you have it from Dr. Thomason that she wants to hear more, and that might just happen to be the question that we're asking, right? So here it is. So what are practical strategies to address these intersections of race and COVID? We have discussed, right? So we've spent weeks talking about some of the challenges, some of what's happening to address COVID. What are we thinking about how to address these intersections though? Race and COVID, and Dr. Thomason did a good job talking about what it might look like, what it might be manifested as in terms of anxiety or misbehavior. But there are lots of other populations, there's lots of communities out there where we're gonna see these effects long-term. And so what can we do about it? I think that's something that we wanna walk away with today, some practical things to do for what seems like will be with us, you know, for quite a while to come. I'm so excited to hear what you guys have to say. You guys can talk back to us. Deborah's talked to us. So we want to hear from other people too. If you want to unmute your mics on Zoom, or if you're still following on Facebook, we'd love to hear what your thoughts are. You're out there, you're seeing some things that might be working, some things that might be terrible. And so you want to stay away from those things, but we'd love to hear what you guys' thoughts are. Mr. Williams though, Antoine, did you have anything to kind of piggyback on in terms of things that you're seeing that are working in terms of the combination there? As we wait for people to jump in.
I've been seeing a lot of conversation around what can we do actionable. We've had, we have the protests. We have a lot of conversations both here in our School of Social Work at UTA, other colleges and universities across the country, and in communities about social justice and race and police brutality. You've seen some actions coming out of discussion of maybe how do we look at law enforcement and policing in our country today, defunding the police, a reinvestment more into social services, lowering the how we set up our response to different types of needs in the community, and maybe funding in a different way. So a lot of that is in conversation. Part of it too, and some of the actions, I'd be interested to see what if some in the audience, others mentioned either students or faculty or alumni, regarding you have to also look internally in your organizations of how to fix, how to change, how to make things better, how to address inequality and race issues and social justice. We have it. So we're both looking externally, but we also need to make sure that we're looking internally to address concerns that may and issues that are in an institution as well. And that should be across the board, whether it's here, of course, at UTA, but at any institution, a hospital organization, and a police department and military organizations, all of those looking internally and dealing with what can we fix, how can we address the issues internally, some actionable solutions. And I know that's part of what we've discussed even in School of Social Work is how do we continue the conversation? What are the next steps, other virtual sessions to then actually get concrete, actionable things that we could recommend maybe internally to the university, but also to other agencies. We have our social work students who are connected to, I think it's more than 700 or 800 agencies and organizations primarily most of them in North Texas, but throughout Texas and even some around the country. How do we help those organizations? What's the actions that may work here and the actionable items that could work in those organizations and agencies as well?
Right, right. So kind of this question of, can you walk and chew gum at the same time, right? So is it that we have to be perfect before we can try to address changes like outwardly? Do we try to do both at the same time? I think those are questions that, you know, lots of organizations, individuals, small businesses that are taking some of these policy changes, you know, are we a perfect organization before we decide to hire a Black CEO to increase representation? Lots of different things that people are grappling with. And you know, I'd be interested to hear from the audience as well as both you, Antoine and Allison, in terms of what you think about that, right? Like, is there space for people to come to the party late, right? So if one company has been very demonstrably anti-racist for years, is there room for people to finally get it now? Or is it, you know, well, y'all are kind of late to the party, y'all should have been doing this, we don't need you. What do y'all think about that?
I have well, my viewpoint, I guess, is based in, I think it depends on which framework you come from. If you have, I think that we're talking about two things happening concurrently right now. There's the social justice movement, and a lot of people misconstrue what that means. It doesn't just mean that I'm in the streets yelling and chanting and saying, these are the injustices, you're wrong, you're wrong, you're wrong. It also means, and I think this is the subtext that folks aren't getting sometimes, we're at a critical point because it's not just social justice where I create an outcry, it's restorative justice about what do we do from here. And restorative justice says you can come to the table at any time point that you are a willing and actively engaged participant who wants to seek change with me. Mm-hmm. And so I think that it's a both and this is my perspective. I'd be happy to hear from other folks. But I think it's a both and because we still need, you know, the outcry. We still need folks who are willing to shed light on the systemic problems, but we also need people who are willing to be at the table to create action to the systemic changes. And so an example of what this looks like, there's actually a department on campus. I work with a diversity studies minor that's housed out of the School of Social Work. And so it's put me in a position to be able to talk across campus through some of that interdisciplinary collaboration. And there's a department where a group of students got together and wrote an open letter about here's what we see as wrong and what we want to see change. And it wasn't necessarily in the department, it was in the profession. So these are students who are taking it on themselves to say, I'm going to walk out into this profession, and this is how the profession you're helping me train for isn't necessarily addressing my needs. And wonderfully, the department reached back out to ask how we can work collaboratively about how do we help create a voice for these students, our students on our campus, to say, we're in this with you and we hear you, but also to then say to the profession, look, we're showing you a model for how to be able to hear the voices, take in what they say, and then turn out work that really addresses the changes. And so I think that's really what we're going to need across disciplines. It's not a social work problem. It's not just a medicine problem. It's across discipline. We need people to be willing to hear the people who are creating the outcry, hear the voices that are saying, these are the systemic problems in the area that intersects with my life every day, and then be willing to turn out an outcome, to convene folks at the table on all sides who are willing to work towards change. So whether you're perceivably late to the table because your organization's never done it, or you lack the awareness of it, is less consequential than are you willing to be part of the change.
Right. I agree with that. I wanted to make sure Melanie Johnson is not still on. She had her hand raised. Melanie, are you still there? Are you logged off? I think she may have had to go. Okay, so we have one comment coming in from Facebook from James Edward Earl II. Hi, James. I'd like to hear your thoughts about trauma-informed care as a practical strategy to address the intersection of race and COVID. So I'll leave that, either of you, Antoine or Allison, if you want to share trauma-informed care as an actual strategy to deal with that intersection. What do y'all think?
I think it can be. I think that it can be appropriate. it's not everyone's avenue, but I think when done consciously by folks who are actually trained to provide trauma-informed care, I think it can be a successful avenue. So I'm grateful for that comment and that question, because that's actually a specific area that I work in. I'm certified in trauma methods of clinical intervention. And what I have found is where that is something that's impacting so the client, that using that approach can be helpful to maybe our traditional trauma work has to take a pause to address the racial trauma and injustice that a person's experienced so that we can create safe space. The restorative justice movement, and there's some actual interventions that come out of it. That's really what it's all about, taking a trauma-based approach and addressing racial injustice as a traumatic event, and that we need to really form a team around that's going to specifically focus on how do we heal these traumatic events. It's focused on healing. And so in essence, that is a trauma approach. And I think that that is what we need for folks to bring in, to recognize that what's happening right now is the unearthing of a trauma, a long-standing national cultural trauma, and that we have to really be able to address it in these moments and create healing.
Yeah, I would agree. And even in terms of thinking about what's categorized as trauma and racial trauma, if we think about racism within the healthcare system, right, we have this lingering question of, did this have to be this way with the numbers of African-American, Latinx, people of color, even Native Americans who have died as a result of this virus? And so even though we're thinking, okay, people have lost, and so they're going through the grieving process, is it actually a racial trauma that you're dealing with, that as soon as the numbers of people of color are surging, well, we're no longer really kind of concerned about this virus. We know it's only impacting certain numbers of people, right? And so thinking about that as a racial trauma, potentially, even in the loss of people to COVID. So Mr. Earl is the social worker at MPA at Cancer Care Fort Worth. So thank you for your question, Mr. Earl. And I don't see other comments or questions as of yet. Okay, so we have one final question that maybe will get some people thinking. Everything you've ever wanted to say, right? What do you think is missing from this conversation? And I think this question is important because it actually is a model of what we're hoping, again, that we're walking away from the very first question, where we talked about looking at our own biases, our own stereotypes. We have to realize we have blinders. And so we're happy as the UTA School of Social Work staff, faculty, to come together, have these discussions, but we also realize that, hey, we might be missing something as part of this discussion about how we deal with the intersections of race, racism, and COVID-19. So as you guys have heard the three panel discussions, the town hall today, other things you're hearing in your practice, in your work, in your communities, what is it that you've always kind of wanted to say, I wish they would think about this, or I wish somebody would mention this? What do you think is missing from this conversation? And that includes you, Allison and Antoine. I don't know if you guys have something like, hey, we should consider this, or what about this, as we wait for people to chime in. So don't be afraid to unmute your mics or have your hand raised. I think our host Coral is looking to see if you raise your hand, and she can help unmute you if you're on Zoom. Otherwise, I'll look for the Facebook comments here. What's missing? What else should we focus on as we continue to talk about this?
I know there's been quite a bit of discussion in the social work community of late. How is child welfare? How the policies are set up? Are we helping in that sense? Are social workers helping in that sense? Or have they harmed in any ways with the way the system, the programs are set up? And that's the thing. Some of the things we talk about, like in the social welfare policy services and policy class, of trying to understand whatever the problem is in the context of the issue, and then coming up with recommendations and alternatives to a policy. So I'd be interested to see what those are saying about, how we look at child welfare, how social workers work in a variety of settings, wide area. That's one of the great things about this social work career field, working But there's concerns now about working. Do you continue to work with prisons? How do we, we have social workers that work in law enforcement. They work with police officers. Do we continue that connection? And again, are we looking at how do we reform the police? Or there's the other argument of how do we defund police and reinvest in a different way? So there's a lot of that conversation going on. I'd like to see how over time with the research and what the social work practice and how they kind of come together with that. Since with social work is connected into so many different areas of society. And so it'd be interesting with that. That's what I would like to see. It's something that's missing from the conversations.
Yeah, absolutely. That's a national conversation. It's exciting that social work is being discussed so heavily, right, in those conversations. But again, it's kind of one of those, we've seen some of the kind of dialogue there. Well, we should do this, we shouldn't do this. And so internally, as a profession grappling with those very same questions, definitely something that I would like to see the outcome too. I'm looking at a comment from Kendra Sweat, and remember the question is kind of what's missing from this conversation. And she has an excellent point. It says, I do not think that community members experiencing racism are always invited to the table. Professionals may be, but the clients or community members themselves are not at policy meetings all the time. And if that ain't the truth, you guys want to comment on that?
I think that is a profound statement and it's very true. And I think that when you don't invite the community that's experiencing the phenomena or the issue, then you really do miss a lot because, professionals of any type, we have a take on a situation that is informed by our experiences, but the lived experiences of the folks who are dealing with the issue is very important. And I don't think that can even be confounded when you're talking about racism and a health pandemic, and you're talking about academic professionals who, while we may be of the community ourselves, we still need to draw on the greater populace because our standalone experience does not represent an entire race of people. And so that is very important that we don't get episodic into the individual experiences and then the experiences of those few folks who are involved in the policy conversation has to be greater. But I think a large part of that too is as research advances, research has to take a participatory angle when it comes to communities of color to really engage those communities to speak back to you about, do the results of your research really reflect the ideas of the community itself? And I know that in social work, we are big on that there's a lot of research that's based on participatory action-based kind of models, but we definitely, when it comes to communities of color, and as we think about the research being conducted right now related to the pandemic, need that experience to really be able to elucidate the specifics of how the community is experiencing racism in specific as a component of that. And that has to be a part of the dialogue. I think it definitely does.
Absolutely, absolutely.
I like what Kendra mentioned. I mean, not bringing to the table, but also even when they do come to the table, not believing the experience that the person had, the racist experience that they've had. Oftentimes it's not believed or it's not taken seriously. And then often it's forgotten because when you have a racial event, it happens within an organization or somewhere else, the person has experienced it. That's not the first racist event that they've experienced. So they're providing the complaint with in the field of a context of having experienced quite a bit already traumatized by previous events. So when it's only looked at in just that one isolated event, I think sometimes organizations make a mistake with that as well. But not bringing, she's correct and not having them come to the, Kendra's correct, I'm sorry, with coming to the table. But the other part is that even when they are at the table, they're not believed or taken seriously, or there's not a policy in place to really take action with something, to deal with it after it's happened, the experience of it.
Mm-hmm. And I think that we need a diversity of those voices, because you need a diversity of the experiences that are considered racism, because they happen at all different levels. You know, the experience of a CEO who's a person of color with racism may be different than the experience of their employee who also experiences racism. And so we have to be able to account for both, because racism happens across structure and across systems. You know, it's not confined to low-income African Americans or, you know, people of color. It happens across demographics. I'm always encouraged by when folks who have amassed maybe more social privilege based on their economic status, but are still people of color, are willing to share that they still experience racism as well, and they elucidate those challenges. And I think we need that across the experience. We still have to do that for very marginalized communities, those in low income, but I think we have to not confound the statistics that, most research always says, or most research says, low income and African American communities. Those are not synonymous. The demographics are somewhere around 25% of people of color, 23 to 25, live in economic disadvantage. Well, that means a whole 75% perceivably or more do not. And so we can't confound the statistics of that. While we need to address that community's needs and the realness of that, we also need to address across the experience. And we need the voices from all of those places.
You may be muted. Oh, yeah.
Thanks. Thank you. I was saying, Kendra also has another question that's good for reflection. It says, actually, how can UTA School of Social Work help other UTA faculty learn how to support our students with the lens of this intersection of race and COVID? And so, I think one of the simplest answers is kind of what we're doing here today and what we've done for the last 3 sessions that we've had is we've, invited everybody, across campus. So this is a different Kendra. My name is Kendra Wallace and I'm an engineer. Okay, so engineering faculty. Well, thanks for joining us, Kendra. And so this is definitely one of those ways by inviting faculty from across campus to these types of dialogues, to these types of panels, to these types of sessions, to try to share things that are sometimes really embedded in our profession. Not saying that social work is a perfect profession, but definitely something that we try to gear ourselves towards. And so these are the types of things that we can offer. But Allison and Antoine, I'm not sure if you guys have other ideas for Kendra, who's in engineering, that's saying basically, other faculty need to hear about this too.
I think that you shared a lot, like consuming the things that the School of Social Work is putting out, but also being willing to work collaboratively, which I know that UTA is a very collaborative environment. So I know that we could definitely create a bridge there, but the work collaboratively to bring that into the classroom, whether it be, or to the departments, whether it be some type of co-hosted event, or if it is just an actual presentation in a classroom setting or anything of that nature, or maybe it's an actionable kind of service learning engagement collectively or something. But bringing those pieces in so that students are seeing the collaboration that will happen out in the field, and it's a model for them as they go into the profession of how they take this informed knowledge with them into their future tense environments and the work that they will do. But I also just really think that it's kind of, not to put a plug for the diversity studies minor, but the idea of the diversity studies minor.
I was going to do that for you. Go ahead, though.
It wouldn't just be housed, it's housed in the School of Social Work, but it is for the entire university. And I kind of have kept a running tab of how I've seen the potential occupational experiences open up for students who really are interested in diversity studies, but maybe they're an engineering major, or maybe they're pre-med, or maybe they're in some other department. And there is a real space right now that's going to be carved out and that we have to continue to help be carved out across disciplines for a diversity and inclusion officer. And so something like the diversity studies minor at UTA is an opportunity for, within their respective field and discipline, a student to become further immersed and educated about how they can actualize that role and continue their advocacy in their professional work. But what we need is to hear departments value it. We need to see other departments value and kind of really see a privilege in that experience, that it needs to be added to their curriculum, that they need a course that helps their students stay within their major, but now take on that diversity studies minor that helps them be able to actualize their professional goals in their position. And that might not be a student who themselves identifies as a minority, as a person of any minority culture. It could be that they just want to be a part of that work and they need the allied support from their department to know, how does that look in the future for me? And so I think we have to work collectively across the university to bolster that minor and to bolster that diversity education across disciplines, across departments.
Yeah. I think that diversity studies minor or the certificate really helps having that at UTA, and then students across disciplines been able to do the minor or the certificate. I think I recently read, university is looking at how to add into the curriculum or into courses anti-racism that's infused across disciplines. So it's not, there's always room for improvement in social work and even social work education, but across, even with you're in the STEM programs and engineering and the sciences, but having that in the courses, in the curriculum, or as a requirement, and when they come in as freshmen or as transfer students. I know we have some of those courses that they're required to take now. So maybe that's something university is looking at or should look at as we move toward. Those are some actionable things to add into that. So it's infused across their time here. Yeah.
Okay. Yeah. I think additionally, something like that was mentioned in President Lim's letter about some of the ways they're trying to address diversity in campus. And Kendra, specifically talking about faculty, making it potentially a faculty requirement to go through some of those courses as well. And so that wouldn't be necessarily from the School of Social Work, but university-wide. So that would be helpful as well. So that's another way. So hopefully that answered your question. And I'm sure any of us and any social work faculty would be happy to talk to you more about that. Thanks for the question and comment. We have a comment from Facebook. Rosie C. Sanders, the engineers are out here today. She says, as an engineer and lacking the social work insights, I find the term trauma-informed fascinating. Training and trauma-informed interactions needs to be represented at all levels in an organization, in my opinion. And I think we probably agree with that, right? So again, kind of making sure that people understand some of the jargon we used. I think we've covered that. So thanks for your comment, Rosie. And I don't think, let's check again. So Kendra responded and said that those are some great ideas, and thank you. So I guess now we will open it up to any general questions or comments that we have. We don't have any more specific questions to pose to the audience. So if there are comments, thoughts that you've had as you've been listening, now's the time to share that. Other questions you have, this is kind of an open forum time and perfect timing to begin to wrap up. So we'll kind of leave the chats open. Raise your hand again if you want to share something. So we'll leave that for a few minutes if anybody has to share before we begin to wrap up. And also, Antoine and Allison, I'll ask you guys to kind of gather some thoughts, just some last things you want to say before we close, as we give others a chance to chime in. Make sure, yeah, we got all the questions. Checking all of so Facebook, Zoom, hands raised. I think we are good. So if you guys want to give some kind of final thoughts, and I'll close this out.
I could go first. I guess I really like to focus on that last section about the last kind of area we covered about the intersection between race, social justice, and COVID-19. I think that really, if I had wanted someone to take away a specific kind of concept from across these panels, I think it's about being intentional. It's about recognizing, seeing, and being willing to be an actor who supports in some way related to these issues. And for me, that looks like acknowledging the social challenges across disciplines. So that might mean you acknowledge them in your work setting, whether it's healthcare, education, law enforcement, whatever the case may be, now acknowledging the social challenges related to race for communities of color, African Americans in specific during this time. And then being able to acknowledge and draw on the cultural strengths. Because what we talked about in each of these sessions is not just the issues that are presented, but we talked about some real solutions, and we talked about those based on the strengths of these communities. And I think that even there's greater strengths than those we could possibly name, because you have individual strengths from every person, but you also have kind of community-based strengths that, one of the things I highlighted today is that for a lot of African Americans, we've sat so long with the experience of racial injustice and racism that we actually don't give credence to the pain that comes with it sometimes. And that can be a strength that can be kind of reframed and used in any context that we are working with someone. So whether we are a social worker who's working in a community context with, children and families, or whether even, for the folks who are joining from other disciplines, as you have students come to you or those folks who you work with, really helping them draw on the strengths that are inherent for themselves as an individual, and then communally and culturally that exist for communities of color, especially African Americans, because that's how we get to solutions. That there are solutions inherent in every situation, and there are solutions inherent in our strengths as people. And so we really just got to be willing to have a listening ear and to acknowledge the experience. And once we've acknowledged someone's experience, then we can start to listen for those strengths. And I think that's what's required at this point across disciplines, across professions, and especially for those of us in social work, is the willingness to sit and to listen and to look for that. I think we have to have that in order to be able to move forward effectively.
Gotcha. I'll read this comment before you share your final thoughts, Antoine. It says, well, on Facebook, let's see, Mr. Earl said, great presentation. And then Caitlin Noble is joining us on Zoom. And she says, I 100% agree with these comments, opinions. Diversity training and trauma-informed training should be a must. I can nod and agree all day long, but without a complete understanding, I won't be able to properly fulfill my role as a social worker. That's very true. So the proper understanding, the takeaway to try to join the challenge and do better ourselves is very key. So Antoine.
And that's good tie-in, because right now we're going through quite a bit, country, nation, community, but it's also a historic time too. It's a time for us to be able to, more people are engaging, coming together, trying to understand and participating, those who didn't participate before, in social justice causes and dealing with racism and issues with disability and diversity. So we're at a time where people are more engaged with it. One of the things I tell students, I even tell some of my staff, I mentioned last week, for example, using it as an example, if you've never heard of Juneteenth before, the question is not, why wasn't I taught that? Is what have you done to learn more about it?
Right.
After, I kind of say, you get a pass until you turn 18. After 18, you should be out there learning about other cultures, environments, understanding the issues. It shouldn't always be on African-American, the Black community, to talk about race and social justice causes. So as students and practitioners, it is lifelong learning. It's always some new, staying out there, reading, understanding what's happening, especially if you're working in a primarily Latinx or Latino community. What are the issues involved in that community? What are the concerns culturally? What are the health disparities? Is it a food desert community? Social justice, same thing, predominantly Black communities. What are those issues? Learn about them regardless of your background, but understanding, reading the peer-reviewed journal articles and the publications that are out there, staying connected to groups on social media platforms that are engaging, that are talking about those issues and getting uncomfortable with it. And so oftentimes I think it's this feeling that we have to be spoon-fed. I have to go, someone has to tell me, go out and learn and research and understand, why is that offensive? Why does that affect people in a certain way? What's the historical parameters behind that? And so it's incumbent. So I guess I'm saying it's a personal responsibility too. And hopefully with these conversations that we move toward the actionable items when their racism and racist actions happen, but also on a personal level, whether you've been in a social work career field for 20 years, are you staying up to date? Are you learning? Are you doing self-analysis of yourself? Am I being my best? Am I actually being racist? Do I have some implicit bias that is actually that is leading to racist actions? So I think needs to be part of conversation and encouraged from the student level all the way through, and always questioning and going out and learning. And I think this helps that, but that's part of moving forward.
I love those comments, Antoine and Allison. And so I thank you guys so much for your insights. And I love the focus on what we can do and the actions we can take. And I think that's so important to take away from today's conversation. And something we've probably touched on, but as we're talking about communities, and I know Kendra had the point about their voices, making sure that we're being part of civic action, right? And making sure that we're responsible citizens. So it's great within our professions to do our very best to push our professions to the edge of understanding what it means to be anti-racist. But it's also important for us to support policies in our society, in our country, in our state that will also make things better for the very clients we're talking about that are marginalized right now. And so that means exercising our vote. And so we know that there are small and big elections. And so part of, again, taking your responsibility, Antoine gave the age 18. Well, that just happens to also be the age you can register to vote. Exactly. That's one of the takeaways I hope you guys will value here, is that you have a lot more input in society than sometimes we think we do. And so whether you're at the boardroom table, at your kitchen table, or standing in line, at the voting precinct, we hope that you guys will learn more, study more, but also take action. And so I appreciate the dialogue today. So I want to thank the audience on Zoom, on Facebook. I want to thank our moderators again, our hosts, everybody that's been able to make this happen, and not just today's event, but also the previous two. It's been a lot of work, but we are happy to hear that you guys are learning and getting things from it. And so I just want to close by saying not to forget to follow UTA School of Social Work. Some of the comments were about how can we learn more about this. Follow us on social media for any upcoming events. And I want to thank you guys for joining us. And let's see. Yes, that's what I did. I invited everybody to follow social media. All right, everyone. So you guys take care. Enjoy the rest of your day, and we'll sign off.
Thank you.
Okay, Deborah's asking, how do we request CEUs again? I don't know if you want to touch on that. Coral, I think you have to email. To request CEU credit, at the top of the chat, it says, please email School of Social Work Special Events at uta.edu. So hopefully you got that email.
And it's up on the screen.
Okay, awesome. All right, well, I'm gonna leave. Y'all take care.